All right, hi team. This little addendum to Dr. Zach's protocol is one that we went over a couple of weeks ago in my presentation, and I just wanted to demonstrate it visually for you. This is not a complete exam. This is just a critical part of the exam where we are documenting and charting. So when I'm doing an exam, I'm looking at the x-rays, and I'll note whatever it is that I want to note, such as tooth number 31 is missing, and I'll tell the treatment coordinator, Amy in this case, Amy, tooth number 31 is gone, and she will be on the charting portion, restorative charting, and she will remove it. She does not need to go in and write in that tooth number 30 is missing in the progress notes, because, go back to the other screen, because any information that's entered onto the charting is clearly documented without any mistyping by the dental assistant, by the treatment coordinators. It is clearly represented on the charting part of the program. So what we're trying to do is we're trying to make sure that we're concentrating on the charting being correct. So Amy, on tooth number 2, please indicate there's decay on the mesial. Amy's not going to go to the progress notes. She's going to take all of the pre-existing and any problems that I find on the x-rays, or any problems that I find while I'm doing the exam. All pre-existing and defects or problems are going to be charted. What is going to go on to the progress note is certain things that cannot be charted, such as I might be doing the exam and the patient I may elicit pain on tooth number 5. So I'll tell Amy, please put in the progress note that patient feels pain to percussion, pressure, or whatever, something that would not be indicated on the charting. I might tell her, go ahead and make a note that the patient has extensive erosions, but I'm not going to have her type in each tooth number and each erosion. We're going to go back to the charting, and we'll tell her there's erosions on teeth numbers 4 and 5, Amy, on the facial, and she will document them there. Now let's assume that we've got everything documented now. As the doctor, as the diagnosing doctor, you are responsible to make sure that this charting is correct. So I'm going to ask Amy, do you have all the charting completed?
Yes.
All right, let's check it, Amy. Let's make sure that we've got everything correct. I'm responsible for this, not the treatment coordinator. So I'm going to look at the charting, and I'm going to see there's the decay on tooth number 2, there's the erosions, there's the missing tooth. Then I'll say, okay, Amy, the charting is complete, and I'll give her any updates on the progress notes. Amy, please note that the patient and I discussed on tooth number 31 how important it is to replace that tooth with an implant. Okay? Then when Amy tells me the progress notes are complete and the charting is complete, then I will give her the treatment plan. And she will be looking at the treatment plan and making sure that wherever there's something in red or pink, she will know that she should be expecting treatment to hear me give her treatment for that, or a missing tooth. She should be waiting to hear treatment. So I'm going to be looking at this, and I'm going to be giving her the treatment plan. If there's anything that's missing, she's going to say, Doctor, how about tooth number 5 if I forgot to tell her to do a restoration on tooth number 5. Then once she does all the treatment planning, and then the doctor will look at the treatment plan and make sure that it is complete and accurate, and the doctor should also look at the charting and make sure that nothing has been forgotten. And when you go back to your office after doing the exam, you can review the progress notes and put in pertinent information that relates things that are not charted, such as patient is apprehensive, patient is not interested in implants, only wants partials, things that would allow somebody else later to go back and get a feel and an understanding for what the exam was. But the charting has to be correct, and we do not want to be going into the progress notes and typing in every pre-existing and every tooth that we're wanting to do a filling on, because that just introduces unnecessary error into the equation. Okay, if there's any questions on that, please let me know. Thank you.